afternoon and welcome to today's roundtable discussion. Today we're going to be talking about the impact of COVID-19 on family childcare providers. My name is Linda Smith and I am the director of the Early Childhood Initiative at the Bipartisan Policy Center. And here with me today is Suzanne Morris, who is also a fellow at BPC. For those of you who don't know us, the Bipartisan Policy Center is a Washington, D.C. based think tank that strives to take the best ideas from both sides of the aisle to put together and promote solutions to America's most pressing problems. And I think it's fair to say that there's nothing more pressing today than getting our parents back to work. And of course, that takes childcare. This is the second in a 4-part series that we have been doing. The last one was 2 weeks ago, where we looked at the big multi-site childcare providers, had a conversation with them. So today we're going to be talking to family childcare, as I said, and then next week or in a couple of weeks, we'll be talking to parents, and then finally ending with the small single owner childcare providers in the country. So with that, I want to just make you aware that we're going to be taking questions towards the end of the conversation. Suzanne will be monitoring the chat function and will be getting us ready for those questions. So enter them in the chat as we go along. Joining me today as co-host of this discussion is Lanit Dumas, Executive Director of the National Association for Family Childcare, an old and trusted friend of a lot of ours in early childhood education. And I'm going to ask Lanit to go ahead and introduce herself and describe the NAFIC, and then she is going to introduce the people who will participate in the roundtable with us. So welcome, Lanit, and thank you for joining us.
Thank you, Linda. It's a pleasure to be here with you and all of our guests. As Linda said, I'm the Executive Director of the National Association for Family Childcare, which is the National Professional Membership Association for home-based early care and education providers who across the United States who come together to offer provider-driven advocacy and family child care specific quality standards. We understand that family child care educators participate in a variety of programs across the country and a variety of funding streams across the country, depending on state rules. Those programs include subsidy dollars, pre-K, public pre-K dollars, early Head Start partnerships, the child and adult care food programs, and other quality improvement initiatives. So we recognize that family child care is an important part of the fabric of early care and education, and that we are the workforce behind the workforce that allows communities to get back to work and for community economic impact. Today, I have the pleasure of being with a panel of family child care practitioners and supporters. So we have Emily Barnes, who is a family child care provider in Kansas. Wen Busman, who is the Executive Director of Infant Toddler Family Daycare, which is a family child care network serving the Washington, D.C. metro area. Tanya Miller, who is a family child care provider in Virginia and a member of the Infant Toddler Family Child Care Network. Cheryl Teagues is a family child care provider in Minnesota. And Bridget Uzel is a head educator at My Village in Montana. It's a pleasure to be on the panel with these ladies, and I'm going to pass it back to Linda.
Thank you, Lanit, and I appreciate all of you for joining us today. And we were talking earlier, it's a thing to do with Friday afternoon with people who all of us got up and actually got dressed and put makeup on today because we're not used to doing that anymore. With that said, to get this started, I want to set the stage a little bit for the conversation that we're going to have, because family child care is a very integral part of the early care and education fabric of this country. And in many parts of the country, it's the only option that parents have. So the importance of it cannot be overstated, I don't think. One of the things that we know about family child care is that in many ways, it's the often unrecognized, as I sort of alluded to, part of the system. And that plays out in a number of ways. We at BPC have been looking at family child care. And for example, in all but 2 states, family child care providers have the lowest market rate subsidy rates in their states. And that's troubling because they often are providing longer hours of care with no relief. They're providing care for non-traditional hours and a number of other functions that is not reflected in the way they are reimbursed through our CCDF subsidy system. In addition to that, only 19 states, according to our analysis of state plans, support networks with public funds, which is something that we want to talk a little bit about today. So we know also from studies done by the National Association of Regulatory Agencies that family child care has been on the decline in this country for the last probably 15 to 20 years. And so what are we going to do about that as we move from our current situation of COVID-19 into what we all hope is a better approach to childcare? We want to have a conversation with these folks on this webinar about how do we move beyond and how do we get something better as we do that. Let's put a slide up, which I think introduces the first topic that we're going to discuss today, and that is family child care and the accessibility of it. And I think it goes without saying that family child care was the one program that really stood up during the initial close down of things related to the COVID experience. And as you can tell here, about 28% of families, we did a survey in April, and the results of that are shown here, where 28% of family childcare providers remained open for parents without any scheduling change. And that was compared to parents, reports that only 10% of multi-site centers were open. So family childcare came in and filled a gap in this country for some of our essential workers very early in the pandemic, and continued to do that, as is shown in the second bullet, as we moved towards the end of summer, and that rate stayed fairly consistent into August. So what I want to do now is start with some questions and go around talking about, okay, so we know that the COVID experience had an impact on families and that centers closed. Many of you stayed open. I'd be curious as to our panelists what your experience was in terms of COVID. What did you find with your families? What were their needs early on? And we'll make a point of this later on because I think it was important how family child care responded. So let's turn to Emily. And Emily, why don't you start this and describe a little bit about what happened early on with your program and COVID?
To keep their family or their children at home, I remained open and had some families continue to send. I remember in the beginning, there was one day when all the information was coming from different resources and it was so confusing. And I took one day to just listen to webinar after webinar. And I sat down and I spoke with all of the parents and said, this is the information that I'm being given, but it changes daily. I will stay open and try to keep you safe. But as a parent, you have the right to make the choices that you need to make. And a few families chose to keep their children home in that time. Specifically, one family needed the ability to stay, and I had committed to all of them that I would stay open for as long as I could. By the time we made it through the spring into the summer, families began to return because they could not any longer balance the dynamic of working at home and having their children. So by the time we got to end of school, children were returning to me full force. And by the time we got through the summer into the fall, all of my children had returned. I had sent some off to kindergarten or to pre-K. And then I continued to have more children replace those who moved on to school. And then I've continued to get phone calls for parents that cannot find places for their children, and I no longer have spots to offer because all of mine are full.
Interesting. So you thought that there were mixed messages early on in the process, and
I
that
did.
had some.
It was right. It was hard, as we were all figuring out what was going on with the messaging coming from different resources, trying to tell families how to keep them safe. My families, every single day, we would speak, and they would be asking me what to do and how to make decisions. And one of the most difficult things was to look at families and say, all I can tell you is what the CDC is recommending and what my training has taught me. And this is the best way I know how to make decisions. They were looking to me as a guide. Um, and my role in their lives offered that ability. But it was definitely a pressure upon my shoulders to help these parents understand this is how you keep your child safe, and this is how you make this and that decision.
Interesting. Tanya, what about you? What was your experience?
So my experience is very different from Emily's. I was in the process of restarting my home daycare. I had one parent enrolled, and she later disenrolled because she lost her job. So subsequently, I did not have any children in my care, and to this day, I still do not have any enrollments, even though I remain open.
And why do you think that is? Is it parents uncomfortable? What do you think is the reason?
I think parents are uncomfortable, as well as because I'm, just restarting my daycare. I think parents probably are not feeling secure yet. Maybe now that the vaccines are out, and I've had both. I think that would be, something that parents might consider if a provider is actually taking care, getting the vaccines, and getting ready to open up. I'm open, and I'm ready to, have parents and children come into my care. But I think it's just fear, the shared fear of it.
And Tanya, how have you been able to sustain yourself without having children in the business?
Well, because I'm part of the infant toddler family day network, the only income I've been receiving is through the funds that I've received from the network, from the relief funds. And that's the only income I've received thus far.
Well, that's a good point, and I think any of our audience that works with Congress will be happy to hear that, because that was exactly what those funds were intended to do. Sherry, what happened with your program?
I'm in Minnesota, and the governor stepped in quickly. He asked us to release our regular families and make room for essential workers, which impacted a lot of families right away, a lot of programs right away. And then we were supposed to release our regular families, which kind of scared everyone. And then in the beginning of the pandemic, there was not as much need for the health workers that they thought was going to happen. So those people got laid off, and we were sitting empty with a lot of holes. And DHS stepped in and started sharing some rules and regulations for health and safety, and gave us a decision tree to follow, which was very helpful. We gave that to the parents. And slowly now parents are starting to trickle back in, but we're doing distance learning, and Wi-Fi in rural Minnesota isn't always great. So that was a challenge. People have lost their jobs, and 35% of our licensed family childcare programs in our county have closed their doors in about a year's time. So we were hurting before, now we're really hurting bad.
But generally, it sounds like you at least give kudos to the state government for what they did to support you.
Definitely.
I mean, I'm not looking.
Right. It was confusing in the beginning, like Emily said. We were getting direction from all over the place. But the children's cabinet here that works with the governor's office has been an asset. They meet with us once a month. They've connected resources to us, and it's made it much more manageable. We're getting our information funneled from one place, and that's been very helpful.
Thank you. When you work at a network level, what did you see? How hard was it for you to manage, and sort of what happened to your?
We early on there was a lot of confusion, like everyone has spoken about. Infant toddler served really as a source of information for parents and for educators. We that was one of the things that I did, was spend a lot of time reading through everything and trying to figure out what applied to family childcare. Family childcare was able to stay open more easily because we had small numbers of children, and we already had a lot of the safety protocols in place, including using gloves, and they were trained in washing hands properly, and sanitation process. So in Virginia, very quickly, the governor determined that childcare was essential. So that was a help. But I have to say that everyone was frightened. So we had most of our providers did close their homes. Early on, there was about 30% who did remain open, primarily for serving children of essential workers. Then in April and May, we went up to about 40% open. July, we were 70% open, the fall 95% open, and now we're at 99% open. And I think a lot of that has to do with being part of a network where we're able to provide information and lots of different resources. I looked at some other interesting numbers, and our number of inquiries went down from 2019 to 2020. Our inquiries in 2019, inquiries for childcare, was 638. In 2020, it went down to 377. The other piece that I took a look at was new enrollments. In 2019, we had 123 new enrollments. In 2020, it went up to 140. And our terminations went down from 2019 to 2020. In 2019, our terminations were 155. In 2020, it went down to 105. So I think that reflects the importance of family childcare. We also found that a lot of our parents were teleworking and still getting paid. So even though there were many that went on leave of absence and didn't pay, we still had about 60% of the parents who continued to pay their providers because they were getting paid, and they recognized that their providers needed to survive as well. I think another very interesting statistic, we track the number of enrollments that we get from the families who get referrals from us, because that's one of the services that we provide, is referring family childcare educators to parents. And typically in the past years, 33% of families who got referrals from us started with an infant toddler provider. In 2020, it went up dramatically. 50% chose us. And our overall enrollment in January 2020, we had 280 children enrolled. In January 2020, we have 287 children enrolled. So enrollment's gone up. That doesn't mean to say that the organization has not struggled and that the family childcare educators have not struggled. They have. There's been, I would say that a lot of the parents that came back part-time, so income has definitely gone down. And another interesting thing that we saw is that a number of parents were planning to move their children into preschool and decided to keep their children in family childcare because of COVID. And then we even saw some parents who had moved their children to preschool and decided to move their children back to family childcare. But everyone has had struggles making ends meet, paying their bills, struggle obtaining PPE, and struggle accessing unemployment. Even though the CARES Act did allow for self-employed, which our providers are self-employed, it allowed them to have unemployment, but the states weren't ready for that change. And there were also requirements in Virginia, and I learned later on throughout the country that you could qualify for unemployment if your income goes down, but many states required that their hours go down. So if you're doing family childcare and you're caring for 5 children and then it is reduced to 1 child, your income goes down dramatically, but your hours do not. You're still working the same hours.
Interesting. Wow, that's something new that I don't think we've heard before. Thank you for that. Bridget, you work in Montana and Colorado, as I understand it, and sort of in some of the rural parts of the country with something, with a network approach. What did you see?
Yes, so I work for My Village, and we do have a network approach to supporting home-based childcare, and recently extended beyond Montana and Colorado to a national level. So we see a lot of, we're able to see trends across the country in rural and in more urban places. Overall, then my number one takeaway is the demand for home-based childcare has gone up dramatically. I echo what Wynn said about families really choosing that setting because it's just less exposure. Your number of families that you are then interacting with goes down significantly. I also think that sort of the secret sauce with home-based childcare is the director of the program is also the teacher of the program. And so when I was running a program in Bozeman, Montana, you can make decisions pretty quickly, which was so important at the start of COVID. And when things are changing so rapidly, you can decide, oh, I have this open space. Let me see if I can get an essential workers kiddo in there. And that was my experience in March and April of 2020, as we were able to open up some short-term spots for specific hospital workers' children. So that quick decision making is a big piece. And then I just want to echo what Wynn said about the network piece. It's so important for home-based providers to be able to plug into some sort of network. And this was highlighted at the start of COVID when things were changing so quickly around what is safe, what is the news this week with COVID, what are the top 10 practices. So.
Mm-hmm. That's really good, interesting. And as I said, only 19 states right now are, according to their state plans, are supporting networks with some of the CCDF quality dollars. As something that we can take on as a country as we move forward, especially with the new money coming into childcare. Lana, what did you see at the macro level? You're working at the, across the country. Anything that stood out to you beyond what we've heard?
On our end, I think we saw a lot of the same things, but it varied across the country. So I think when we were doing surveys, and we did 4 different surveys throughout the crisis so far, and what we noticed was that 2 and 3 of the programs that responded to us were actually open, but 79% of them experienced a decrease in enrollment. Same thing, local information was scarce, but what we noted was that it was more scarce for non-English speaking respondents. So we did a survey in Spanish, and there was a 10% difference in a lack of access to information about unemployment, about PPP, and all of those things. Although across the board, folks were not being connected. We did notice, and this kind of goes to what Bridget and Wynn are saying, we did notice that where there are trusted voices and strong connections, providers did better, because it's very hard to decipher the guidance when it's not specific to family child care. You're not sure if when it says centers, does that mean the home-based setting? And so we are striving to make sure that the guidance and information is very specific and meets the needs of the setting. So, for example, with the unemployment and PPP, the verification that's necessary because is not readily available to a lot of family child care programs. And so in addition to, as Wynn was saying, that there was a need to prove a decrease in hours, there's not always the ability to prove a payroll because it's a single person. So they're not necessarily using a payroll company to show their wages. So that was a big thing. But on the positive side, the flexibility of the food program and some states that pivoted to paying based on enrollment and not attendance was a big boost for a lot of people.
Well, that was good to hear. Let's go down. We want to switch now and talk a little bit more about affordability and sort of what's going on out there. We have a slide that we've been looking into this, and in our last survey, we looked at the affordability issue and what parents say that they can afford to pay. I think this has been something that we've all struggled with over time. But if you look at the latest survey, 61% of parents who use family childcare reported that the most they could afford to pay was $200 a week per child, and nearly 40% of them said less than 100. So affordability is a real issue and challenge for parents. And I just would like to hear from you, sort of what you all are seeing and hearing in terms of this issue with your parents. So let's start with Bridget on this one. What are you hearing in terms of families' challenges with being able to afford childcare and in, specifically family childcare?
Well, it's a really mixed bag. So I think many families can afford up to $200 a week, like the slide said. And then we have to remember that 39, did it say 39% or around $100 a week? So what I've really seen in my experience, both as a public school kindergarten teacher and as a home-based provider, is the kids where their family can afford $100 or less are really getting the short end of the stick of less continuity of care during the 0 to 5 years. And that really turns up in the kindergarten classroom. Kids who can have the same childcare provider, this lends itself to home-based care because that can happen for 0 to 5. That continuity of care just does incredible things for that child's development and their kindergarten readiness in comparison to a child who's had some sort of a rotating door. And that rotating door is oftentimes due to a family's lack of access, nothing that the child is doing,
Mm-hmm, mm-hmm. Wynn, what about you? What are you seeing in the network, and your parents' ability to pay? You're in like Northern Virginia, DC, which is a very high cost area.
Right. So our rates are about $350 a week. And we really have a lot of parents who are middle and high income that are able to pay those fees. But we do get inquiries from parents that can't afford those fees. We do have our own small scholarship program to try to help parents. We don't have that many children through the subsidy program because subsidy has become rather complex for providers, and they also they don't get higher reimbursement rates, and our organization itself doesn't get any funding with subsidy. So that's a struggle. It's a real struggle because even though Northern Virginia is a very affluent area, there's still a high amount of poverty. There's in sheer numbers of families who need those services.
I think if we don't understand anything from COVID, I think one of the things that the country is beginning to understand is that this cost issue is a serious problem for this country, and especially for low-income working families. It's one thing if you can qualify for a subsidy or if you are in the upper income categories, but people are squeezed in just what you were describing there. Let's take a look at another slide and we're going to go to Sherry on this one. In terms of looking at the use of family childcare by region, it's clear that it fills a big gap, as we all know, in rural America. And if you look at the response to our latest survey of family childcare parents in rural communities, their preference is, and in many ways, sometimes only the only choice they have, but 40% of parents in rural communities are using family childcare. That's nearly half. And I think we're going to have to think carefully about the implications of that and how we support family childcare providers in rural America. So Sherry, let's go first to you because you're rural Minnesota, correct?
Yes, I am. I live in a town of about 5,000 people, and I think family childcare in rural Minnesota is important because there are less centers available. Family childcare tends to be more affordable, more culturally based, where we can meet with families' personal needs and things like that. But there are no centers in a lot of these communities, so they rely heavily on family childcare. It's been interesting too because when it comes to the cost of things, that's what the pandemic has really leveled things out as. What can you afford? What can you give up? But I need childcare to cover me so that I can work. And the cost varies from county to county what each person can afford to pay. So when you said $200, I know that that is a high range for some counties in our state. But in other counties in the metro area and stuff, that tends to be a little low for them. So it's a variable.
Mm-hmm. I think that happens, I think, even within the urban suburban areas. So Bridget, what are you seeing on this one? What's your response to that?
Brought up the culture-based education of home-based providers. I couldn't agree more. I think in rural America, a reason why family childcare is such a trusted choice is because there's the trust there. There's the knowledge of, like I said before, the director is the teacher. We know the person, we know the family. And there's a high value placed on word of mouth, and you know someone who has used that childcare provider. And I think that ability to really dive into the culture of the community and have the very cozy, nurturing spot for the 0 to 5 children in the community is just the huge, huge value that family-based childcare provides.
Thank you, Emily. What's been your experience on this one?
So I'm going to support what has been brought up by both Sherry and Bridget. I live in a state, personally, my house is in more of an urban suburban area of one of the metro areas in my state. However, in Kansas, there is a significant portion of our state that is also rural, but even further than that, still counts as frontier. With even fewer, people per square meter, I think is how they do that. So I would second everything that's already been brought up about, the culture, the comfort, the, accessibility, that it's more likely that you're going to know who is around there. And then that is a variable of cost. I know in the rural areas, the providers that I know in the rural areas of our state, they are able to know the families, have strong connections. There's already the community support. And in my state, there's actually been some effort specifically targeted to those rural and frontier areas because of the pandemic to ensure that we have not just sustaining the existing providers, but ensuring that there's targeted effort for support for new providers coming up the way as a result of the pandemic, if they've lost their job and still have the ability to provide care for the children in their communities. And so I think that finding good, strong supports for our rural areas of our country are hugely important. And yes, we do have the cost variability because if you're in the rural area, you may not have access to, or you may not have the ability to pay the higher amounts, the 200 a week, 300, 350 a week. You may legitimately have communities where they need lower cost or needs for subsidy.
Mm-hmm. Tanya, your experience in a more metro area, what has it been in terms of parents and parent choice? When you had a full house, what were parents looking for in your program?
Mainly quality care. Parents need to feel safe. I relocated, and I think, can you hear me? I relocated, and I think that was an issue for me. I now live in Prince William County, and so it's a suburban community. However, I feel like we support families from all backgrounds, all socioeconomic backgrounds, all demographics. And I think one of the thing that parents are looking for is like safety. And again, I'll touch on, because now we're vaccinated, I think parents will feel more comfortable bringing their children into homes.
Mm-hmm. And thank you, because you set up the next slide perfectly. We wanted to show one last slide of what we have found in talking to parents. And if you look at this, parents by far and away are looking for and concerned about as a top priority. Just what you said, the cleanliness, the prevention of illness, no surprise there. You mentioned trust, safety, and so forth. So parents really do place a high value on this. And I think that I've always thought for a long time that family childcare and childcare in particular, somebody said it earlier in the conversation about, we already know about wearing gloves and diapering and hand washing, all that thing. I don't think we do enough to tell the public just how much we do around the health and the safety of children in childcare programs. That's probably our strength, I guess, if you will. So I think that now, as we know, we have the president came out this week and said, okay, childcare providers and teachers need to be a priority to get the vaccine. What do you all think is going to be the impact of that on your attendance? Do you think it matters to parents? Our surveys show it did matter to parents, but I'm curious as to your reaction and what else you think needs to happen in terms of helping parents be comfortable coming back into childcare. So, Tanya, let's go back to you, because you ended on the health and safety. What do you think will make parents be more comfortable with coming back to your program?
Again, as I said, because now they know that we're vaccinated, so that's one less burden, one less thing they have to worry about. And this will allow us, I guess, more money for PPE supplies, so they can come into our homes and see that, we're taking all necessary precautions to keep their children safe.
Mm-hmm. Sherry, what about you?
Well, in Minnesota, we had to create a COVID plan right away. So that is like a list of everything we had to do. We share that with our parents now, so they know what's expected, how our programs are going to run, how we're going to try and lessen the spread of the disease. So I feel like we have that part covered well. But I think, I can echo what Tanya said too. We need more money. We need to have that support so that we can keep those programs going and offering that space for our children. There's still lack of concern in family childcare programs. I know in my area, for families that still are not taking the disease very seriously. And so that scares the rest of the parents. So now that I've been vaccinated and more people are starting to get vaccinated, some of those fears are starting to calm down. The trust is being built. I still show them, this is how I clean. These are our requirements. They hear it and see it because they can't always come into my building to exchange their parents anymore. So they've seen the change, and I feel like we've built that trust. So I feel like we're moving forward there.
Mm-hmm. And Emily, what about you? And what are you seeing in Kansas?
So I actually am going tomorrow morning for my second round vaccine. One of the local children's hospitals coordinated with the county health departments to be able to administer the vaccines in my area to teachers and childcare staff. And so I feel very blessed to have access as quickly as I have. And when I began speaking to my parents about, hey, I'm getting vaccinated, I could see visible relief in my parents, as I had said, I was committed to being a part of the vaccination effort, and B, that their child would be in an environment with a vaccinated adult. They absolutely relaxed when that information was known. And so again, they also wanted to know about what procedures from the very beginning, what procedures was I going to be putting in place about washing things, wiping everything down. How am I going to help prevent illness? We had conversations about the need to keep children at home, even if the symptoms seemed like it was just allergies. Let's keep them home, get on top of it, then bring them back. And as they've seen the success of keeping even the minor symptoms home, that has built trust between them and I as we've made it through this pandemic. And we've managed to keep the virus out of my house, even though we've been operating the whole time. We've kept the virus out of my facility. And so there's very much an effort of building trust, building that cooperative effort between us. And so I would also have to second the concept of I think Sherry was the one who brought it up about making sure that, we get information out, ensuring that the other areas of the country have correct information about the success of the vaccine and what it is doing. And so that way then parents and providers will feel safe as they have access. And this takes money. This takes real, true funding to be able to have continued access to the PPE and the vaccines.
Mm-hmm. There's one topic that we talked about when we all got together a while back, and I think it's important that we put this one on the table, and especially for those of you who are working directly with children. I know I sort of alluded to it when I opened this about the fact that many of the providers have been open throughout the pandemic. And in my mind, that means you all have been under a lot of pressure and stress nonstop since last March, about a year ago this time. We know that there's been pressure on you, on families, on children. I'd really like for you guys, the three of you who are providing direct services, to talk a little bit about what you're seeing with children and the pressure, anything that you're seeing that you think we need to be paying attention to. So let's start back with Sherry.
The children are struggling right now. You're seeing it in their behaviors. They are unsure of, everything has changed. So they're not sure of how to handle things. They'll start to play. It's affecting their social emotional development. They cannot interact like they used to. They can't rough and tumble. And you'll hear them say, "Don't touch her, you'll get the virus." So those things have all changed. I know that when we're working on assessments and things like that, everything is done with Zoom. If you can get an appointment, it's hard to get children assessed right now. In Minnesota, we screen all the children at 3 years old for developmental delays and disabilities. That's been paused. It's hard to get kids in. They all have to be screened before they start kindergarten, and now there's this huge backlog. So, there's all kinds of changes that have happened, and the stresses have been really hard on them. And when you talked about stressors on providers and the extended time that we have been open, that has been a requirement with the grant money that we have received. So you could apply for the $1,200 a month for the health and safety grants, but the stipulation is that you don't take 2 weeks off or whatever. You have to be open for those families. And so that continued stress is traveling on right now.
Mm-hmm. And let's go then to Tanya. Do you have any thoughts on this in terms of what you've seen in terms of stress on parents, et cetera?
Well, prior to this, I worked in a center, so I've witnessed firsthand, the stress that parents are feeling. Also, with the children, before we were telling them, "Oh, you need to share, you need to play with your friends," and now we're saying stay 6 feet apart. They're confused, and so it's been very difficult for them. For parents, what I see with the people I talk to, because I'm still connected with parents, they'll say to me, their biggest thing is fear. because they're fearful of getting the virus and taking it home, because their children are in school interacting with many other children. And that's the feedback that I've gotten from many parents. They're still concerned.
Okay. We're running short on time, and we do want to take some questions from the audience. So the one thing I want to do with the rest of this time is, we gave you a heads up on this one that we're going to give a lightning round and ask you to say if you could talk to your states, your senators, your governors, or somebody here in Washington, D.C. with one recommendation that would help you in terms of getting us back on track, improving all of this, improving the support for family childcare, what would it be? And let's this time start with Lynette and see, what would you say you have learned from all of this over this last year that you want somebody to know about and make a recommendation?
We need to really look at how we're compensating family childcare and how the funds are calculated. There has to be a method for funding this field, and we have to address the private pay. It can't all be connected to subsidies. We have to think about how we're supporting those families, like you mentioned, Linda, that are stuck in the middle some kind of way. They're not high income and they're not quite eligible for subsidy, because that's where we saw family child care providers were struggling when they lost the private pay families. So another way of calculating compensation.
Okay. And I think that's something that essentially going forward, we just really have got to face that. Bridget, what about you?
With 2.1 million women having left the workforce entirely due to COVID, we have to pump the gas on more high quality childcare spaces that are affordable for families, and ties into great compensation for those home-based providers. So it's one big cyclical system that has to be addressed, of affordability for the pinched middle class, and then a sustainable salary for the professionals in this field.
Okay, Wynn, what about you?
So my ask is to fund staff family childcare networks so that we can continue to provide the services that we're providing and expand the services that we're providing to support our family childcare educators.
Okay, and let's go back to Emily. What's your one piece of advice here?
I would ask our Congress people to remember that we are professionals. Many of us have strong education backgrounds in child development and early childhood. And so remembering the reason we stepped up is because we are good at what we do, and we deserve to be able to make a living off of this. Without us, America truly does not work. And so it is necessary that we have sustainable investment in the work that we are doing. The provider fatigue that we are experiencing right now is absolutely real. And as it was mentioned, Sherry had mentioned the behavior changes. We are seeing behavior changes at all ends. And so investment in us absolutely has a positive return. And so it has to be legitimate. This is a human issue about how are we raising up our children and supporting the people who are doing that in the process.
Thank you. We'll make you the poster for this. Tanya, what about you?
Well, what I would like to say, we need to have a comprehensive reform of the adult and child care family food program, especially with regards to reimbursement, the reimbursement rate, and the disparities. Rates should be the same across all programs, centers and home daycares alike. What we're seeing now is centers are getting paid more than childcare. I also recommend that the tax burden be reduced and the paperwork be simplified. Providers should not be paying taxes on funds from food programs, and the amount of paperwork is overwhelming. So many providers would like to become part of a subsidy. However, there's just so much paperwork that's very discouraging. And so a lot of providers are opting not to become part of a subsidy provider just because of that.
Mm-hmm.
And we need more funding. Sorry.
No, I mean, I think that's one thing we had hoped we could touch on would be the child and adult care food program. And we've heard that in other conversations we've had about the frustrations there. But I think that the figure that we have is something close to 800,000 children receive meals through the child and adult care food program in child care. So it's an important part of the whatever we're trying to get done in this country. We need to think about that. Sorry we didn't have any time for that. Sherry, let's go to you on this one, and then we'll take some questions from the audience.
Well, I can echo everything everybody else has said, but I just want to touch on the Child Development Block Grant. Quality and has been working with childcare programs, but the aftermath of that coming through has created a lot more paperwork and a lot more discord for some of the providers in our state. And they're saying that's why they're kind of, a lot of them are closing the doors. They just can't keep up. But I feel like the funding of programs that support quality in family childcare are detrimental to the children in this country, to the providers in this country. I can parallel it with like the Parent Aware program in Minnesota, where the grant money that comes in to help programs create a quality program, you get a coach that comes and helps you. It's basically free advice to that provider, and the money you get, you can build your program and your weak points. The other thing is like, we have a First Children's Finance that's working with the providers in our state, helping them with their business side of things. We get training on child development, but this is unique training for us to show us how to set your rates, how to look at your expenses, how to make ends meet. And I think funding those types of programs are going to extend childcare in the long run in this nation if they could do more of that.
Mm-hmm. Okay, well, let's go to Suzanne and see if we have questions from the audience. Suzanne, are you there?
I'm here.
Okay.
Hi. Yeah, we got some questions from the audience, and quite a few of them build off our conversation around family childcare networks. We have one that you mentioned only 19 states support networks, but it seems important and essential. What would it take to have them in all states?
That's a really good question. Lynette, do you want to take that just for starters?
I think that it has to do with us actually getting into the states and talking with the state administrators about the benefits of networks, not only the business practices, but the peer-to-peer supports, the family childcare specific training and coaching that's possible through those networks, and also the possibility of them being an intermediary for funding and getting things out to folks. But there are lots of different definitions of networks, and some of them are associations, and I think it's lifted up very well in the Bipartisan Policy Center's brief that just came out, or is coming out today. Am I ahead of time?
Today.
And but no, I think that it really has to do with the states deciding that they want to invest in family childcare, and understanding that at least a third of their children under 5 are in these spaces, and that this is a quality space that leads to school readiness and lifelong success. And so how do we invest in that, and how do we get the most bang for our buck? And networks is one of the tools to do that.
Mm-hmm. Bridget, you work with a network system, and you just said you went national here recently. What are your thoughts on this? How do we make sure that we get family childcare better supported and organized?
Yes, so My Village is a little bit of a different type of network, an online platform for home-based providers across the nation. And we are finding that there is a huge need for that community-based support, especially upon launching your childcare. So everything from come to a workshop on creating your family handbook to let's have a goal group that lasts a month around enrolling your first child. Hugely powerful, because many home-based providers are on their own. They're in their home. They don't have colleagues in their four walls. So I can't say enough about just the value of community among home-based providers.
Wynn, do you have any thoughts on this? Because you actually operate one, but how would you expand it? And you said that your state does not support you in terms of, actually giving support to the network.
Correct. We
right?
don't. Correct. We don't get any state funding, and I think one way is to contract with staff family child care networks to provide subsidy slots. In the past, we actually had contracts directly with local jurisdictions to provide subsidy slots. And at one time we had at least close to 50 children, like 10% of our enrollment was through subsidy. Now we only have about 4 or 5. And I think that and we don't get any funding to support subsidy slots. So that would be a big, I think a big first step in supporting networks so that we can support the providers.
Okay. Suzanne, do you have another question that we could do? We are running out of time, but we'll take one more quick one.
Yep, I got one more. Is BPC advocating for rate equity for all child care providers at the federal level?
For what equity?
Rate equity.
Yeah, absolutely. I think, yes. I think one of the things, we did do a subsidy, a market rate report here recently where we looked at this. We actually think it's not an issue of rates. It's more of an issue of calculating what it costs to do care and then setting things more, rather than a market rate, setting the rates that you're reimbursed from public dollars based. And that's why I went back to what I said earlier with the issue of family child care providers getting lower rates in all but 2 states in this country for longer hours and more flexibility. To be honest with you, families, going back to the chart that we showed, families value flexibility very highly. That's what our survey results show. Yet, and where that flexibility is in family child care. That should be compensated. But yes, I think we would do that, and definitely think that the rates are key to what is going to turn around this whole situation in this country. So I think we are running out of time. Suzanne, do you want to put the slide up? Because Lynette, thank you very much for the opener. We have just and are releasing today what we call the Family Child Care Policy Framework. You can see it here. We'll link to it, and you can go to our website and find it. You see the organizations that we worked with on this. It basically gives an overview of family child care and makes recommendations at all levels, federal, state, local, philanthropy, and elsewhere, to how do we proceed on to tackle this issue of support for family child care in this country and reverse the trends that we have seen over the last years of a loss of providers nationwide. So we want to turn that around. So we urge everyone on this call to take a look at this framework and join us, if you will, in supporting some of the recommendations that are in there. So with that, I think we're just about out of time. I want to thank our panel for their candid comments, and they're working with us, and they're doing this on a Friday afternoon. We very much appreciate it, and we look forward to the next webinar, which will be April 1st, same time period at 1 o'clock. And we will be talking to parents who use some of these programs and what their experiences have been, and how we, from their perspective, what we can do to improve this system going forward. So again, could have spent so much more time on some of these topics. Wish we had more time, but again, thank you all so much. Very much appreciated. And everybody have a great weekend.